Hi, do you mind if this is recorded for educational purposes?
No, that's fine.
My name is Kelsey. I'm a physical therapist.
Hi, my name is Mary.
Nice to meet you. So what brings you into physical therapy today?
Well, I'm having some pains with my knee. It's starting to, it bothers me, it swells, and it, aches.
What? Okay. And which knee is that?
My right knee.
Your right knee? Okay. If you had to grade your pain, what would you grade it as on a scale of 0 to 10, 0 being no pain and 10 being the worst? What would you grade it as?
I'd say between a 6 or a 7 at the worst.
At the worst?
And probably I stay at around level 2.
2? Okay, and so 2, you're never out of 0?
No.
Okay, all right. And is the pain, does it come and go for the most part? Or?
Yeah, it comes and goes depending on what my activity level is.
Okay, so what brings it to a 6 or a 7?
Yard work, mowing the lawn, or going up and down steps a lot.
Okay. Do you notice that it's at one time of the day more than another? So maybe more in the evening that it hurts versus the morning?
I would say that it hurts worse as the day goes on, depending on how much activity I've done during the day.
Okay. And how long have you been having this pain?
Probably around 4 years.
4 years? Okay. And have you seen anyone in the past for this?
I did see an orthopedic doctor about 3 years ago.
Okay. And did he do anything? Did he treat you in any way?
They did some injections in my knee, and that was about it.
So you just did one series of the injection? Okay. Did he take any images that day or MRIs, X-rays?
Yeah, I had MRI done on my knee, and it just showed definite swelling and some, I guess, tissue loss.
Okay. Did he ever give you a straight diagnosis of anything?
Well, some of it was arthritis, but nothing more than that.
Okay, all right. And so, as for your general health, how is that? How is any conditions with the heart or lungs? Any like diabetes or?
No, I have high cholesterol, but other than that, nothing.
Okay. Are you taking medications currently for the cholesterol?
Yes, I do take cholesterol medicine.
Do you know the name of that or?
Not off the top of my head, no.
Okay. And are you taking any other medications?
Just Advil for pain when the pain gets bad.
Okay, so you take that for your knee?
Yeah.
Okay, and if you've never been prescribed any type of pain medication or anything, no anti-inflammatories? Mm-hmm. Okay. And as for your family, is there anyone in your family that may have had arthritis or any type of joint problems in the past?
Not that I'm aware of, no.
How about for your, as for your job, is your job being affected by this? What do you do for your job?
It's a sedentary job, so I'm not having any issues. At my job, occasionally when my knee is bothering me, walking to the printer or maybe to a meeting or something, it may bother me.
No trouble like getting out of the chair or things like that? Okay. How about for your, regular hobbies, anything that you like to do for fun that has been inconvenienced by this?
Yes, the gardening and mowing, yard work and things like that, and walking. I like to walk, so that's sometimes affected. And if it's bad, I'm not doing those things.
And what's your current form of exercise? Would that be walking or?
Yes.
Okay. And how about your goals for physical therapy? What would you like to accomplish from?
Well, I'd like to accomplish with my knee getting better, or at least getting to the point where I'm not having to take Advil, and I would like to do this without any kind of surgery.
Okay, so you would like to just basically find relief for your pain, and you hopefully want to avoid surgery.
Yes.
Okay, well, hopefully we will begin to work on that. The next thing I'll do is go ahead and take a few measurements and stuff like that, but we'll go ahead and get started on working on relieving your pain.
All right, thank you.
No problem.